Hi guys, this is Tavishi Dogra and you are watching TheHealthSite.com. Today we have Dr. Rubina Shahnawaz, a robotic urogynecologist at the Fortis Healthcare, who will elaborate on the role of robotic technology. How is it effectively treating, the urogynecological disorders in our daily life? So let me welcome you. Hello, doctor. How are you?
I'm good. Thank you, Tavishi. How are you?
I'm also fine. So let's quickly begin our session and let's, dispel some myths around this topic.
Sure.
What are the daily impacts on women if we talk about such issues?
Yes.
So how it impacts and how it, affects the women's overall health and their quality of life.
Quality of life. Yeah. So it's mainly a quality of life issue because with women think that this is part of aging. That's the age-old myth that it's part of aging. It's part of childbearing. And you must have seen so many memes even on Mother's Day where you're the reason I leaked urine. So it sounds funny, but it's the one who suffers is the one who knows what happens. So like I said, they just isolate themselves from the outside world. They don't go anywhere out. They are scared because the minute they sit in a vehicle, the bumps will cause them to leak urine. And they have these masses coming out, which is uncomfortable. So they don't even walk. You don't walk, you can't take care of all your joint issues, your BP, sugar issues. So all the quality they just change who they are. And people attribute it to menopause, which is not the entire thing. It is so much more complex, anatomical, and of course functional issues faced by these women, and leads to recurrent urinary infections. Too many urinary infections can also damage your kidney health. They just build on and on. So we need to tell women that these issues are treatable. You don't have to live like an old woman. These days 60 is the new 40. So you want to change who you are or how you live your life because of some small issues which have great technical as well as simple solutions as well.
So what are the current treatment options for such disorders?
So treatment options is like asking me, it's a very blanket statement because it varies widely. So we tailor make these solutions based on the age, the number of, like I told you, right, various parameters. So it range from a simple lifestyle modification to maybe some drugs, to our latest surgery wise. There are so many minimally invasive like a daycare surgery, which ranges from how we go through the natural orifice, the vagina, to minimally invasive laparoscopic, to the latest robotic assisted technology as well. So we use all of these based on the patient's needs to give them the solution they need.
If we talk about the robotic assisted surgery, so how it benefits in these procedures?
Yeah, so the main thing here is the minute we say robot, people think that we are sidestepping and there's one thing up there and doing. So the term itself is not robotic surgery, it's robot assisted. Like how now you're using the latest technology camera to give your face clarity, you use these filters, but it's you who's sitting and doing it. Similarly, it's us surgeons who decide every single thing. The robot is an arm. So instead of our arms, because we are human after all, we do tend to have tremors when we do our third and fourth surgeries of the day. We tend to, put more pressure, but the robot is steady. So we assist the robotic assisted arms, and we work with the Da Vinci from Intuitive. So that's been the pioneer in robotic surgeries. And the way, it has eased the surgeries, giving the surgeon, not just the surgeon comfort, but it's also about the difference between an iPhone 14 and an 8. The amount of magnification, the dexterity with which we do our surgeries. So we're able to give precise solution, because all this is about repair. It's not just taking out a tumor. It's about repair and giving the perfect solution. So the more we are able to see it, the better we are able to handle tissues, the better is the result to the patient. So that's how it helps us deliver the best result with the best available Da Vinci robot.
So doctor, my last question to you, and I would ask you to share some piece of advice to women, who are a bit hesitant in seeking medical help in such problems, urological
Yeah.
issues.
So I hope it reaches many of those women
Yeah.
who are just googling online and hesitating and seeing where do I go, and I'm sure
Yeah.
this is how it pops up in their feed as well.
Hmm.
That please do visit your urogynecologist, because we'll
Yes.
be able to at least tell you what can be done, what cannot be done,
Yeah.
and you have simple tailor-made solutions. And
Yeah.
all of these are a daycare. You will be people think that once surgery, they always listen to the neighbors more than the doctors.
Hmm.
Now
Hmm.
we can send you home the very next day, thanks to all the advances, be it
Yeah.
robotic assisted or be it vaginal. We'll be able to send you the very next day, and you'll be able to be yourself much better than sitting and suffering and hiding issues. So please come out and talk to your urogynecologist, and we'll help you find the solution which will work for you.
Definitely, definitely. Thank you so much, Dr. Rubina, and I hope our audience will go back with all the valuable insights that you shared with us. And thank you so much. Thanks a
Thank
lot
you.
for joining.
Thank you.